Hello, I'm Dr. Robert Russo, Executive Director of the Connecticut State Medical Society. Welcome to On Call with Connecticut Physicians, the Medical Society's podcast initiative. Hello, my name's Dr. Bob Russo, the Executive Director of the Connecticut State Medical Society. The Connecticut State Medical Society represents 4,000 physicians in the state of Connecticut. Our mission is advocacy for the physicians and their patients. Welcome again today to On Call with Connecticut Physicians. I'd like to introduce Dr. Greg Shangold, the president of our society. Today we're going to talk about recreational marijuana and its use and abuses. Just as a little bit of an introduction, we do understand that there are multiple factors in play, some judiciary, maybe decriminalization, some financial or expense-wise with taxes and things like that. But what really concerns the doctors is what sort of effect it's going to have on public health and what we're seeing today, and to give you some facts and figures that may be very useful when making some of these decisions. So, Dr. Shangold, if you would, can we start the conversation about recreational marijuana?
Yeah, absolutely. Let's get going. Thanks for having me here, Bob. And I think at the beginning, we want to just use some terms. So I might refer to marijuana use disorder. In the past, this is when people had addiction, but like many other drug problems, we want to see this from a public health point of view, from a medical point of view. And when people do develop addiction, this will be referred to as a marijuana use disorder. So one of the top priorities for us is to do what's right for our patients. And we've seen what recreational marijuana has done in other states already where they've passed it. Many states already have a track record. And our biggest concern is how this is going to affect our youth in a permanent way, and how it can affect other medical outcomes such as trauma and other health outcomes.
Well, as an emergency room physician, can you give us some examples that you may have already seen with medical injuries or complications of marijuana use?
Sure. So marijuana use, whether it's illegal through medical marijuana or through recreational marijuana, has changed over the last 20 or 30 years. The potency of the current substances is much higher, and we're seeing the effects of that. So in the youth, and what we've seen in other states is that there is a 4 to 7 times increased use of a recreational marijuana, at least 4 to 7 times of a use disorder, which is a true addiction for the youth once it becomes available. Washington State has seen a double of the fatalities in car accidents since recreational marijuana was passed. And youth suicides have gone up from 14 to 23% that are now positive for marijuana when they're in the post-suicide analysis. So youth tend to stay away from things that they perceive that are harmful for them. And as we're trying to look at the complexity of marijuana, we've lowered that impression that this is a harmful substance. But the truth of the matter is that the youth are now using it more. Even in Connecticut, we see 46%. This is statistics from DEMIS. And now in 2018, 46% of 18 to 25-year-olds are using marijuana. Fortunately, in the 12 to 17-year-old age group, it stayed relatively constant from 2008 to 2018. But we continue to see this rise, and we really want to hold that age group not to be using it anymore because of the harm that it does bring to the youth.
I do know in younger people, while the brain is still maturating, that there's more damage to brain tissue with the marijuana that's being used. Are there other complications of the use of perhaps reaction times and things like that that add to trauma cases?
Sure. The state of Connecticut has made many changes to our car laws, especially for our youth, where to try to decrease youth fatalities. But the Journal of the American Medical Association, just within the past month, released a study that shows impairment is up to 5 hours after the use. And right now, we don't have the medical infrastructure to do quantitative testing on people that use marijuana so that they can be held criminally liable when these fatalities occur. Again, in Washington, with the passing of recreational marijuana, within 1 year, they saw a double of the fatalities. But unlike getting an alcohol level, we don't have that type of marijuana level. The police don't have the tools to hold people for impaired marijuana use, but we have seen the medical studies that show that this impairment lasts for up to 5 hours after using marijuana.
Some of the questions that have come up is the cost that may be reflected back on medical care because of the use of recreational marijuana. Can you give us some concepts about where you see those costs coming from?
Sure. So, if one of the top priorities is to make sure our youth do not access marijuana, similar to tobacco cigarettes, which incidentally, the legislature just increased from 18 to 21 years old. But there is a whole entire infrastructure within the government to prevent youth from accessing tobacco cigarettes. Now, some of this is paid for through the tobacco settlement money, but we don't have that type of revenue through marijuana. Second, the medical costs are going to be uh, clearly apparent. We've already talked about trauma visits. We're seeing a huge rise in hyperemesis cannabinoid, which is a cyclic vomiting and an uncontrolled vomiting that has multiple emergency department visits in an attempt to control. So those are two of the bigger costs. On the same side, we want to look at good medical research into marijuana, and as well as we are supportive of the decriminalization. So this really has to be thought out, and so that there's less harm to our patients and to our communities.
Do you see a connection between vaping and the possibility of recreational marijuana increasing because our youth are vaping at an outrageous number at the moment?
What we've seen is, and this is sort of dissipated with coronavirus, but all of the vaping deaths that were happening throughout the country were due to modifying the electronic delivery devices to be able to vape marijuana. And those are the ones that were causing serious lung injuries. Ironically, very similar to what COVID is causing lung injuries to now. Um, and so um, that access to those vape pens and vape devices, and then modifying with marijuana is even more harmful to the patients.
And I think that's very important because I think we're going to see a balance of what it costs because of the use of the marijuana versus perhaps money that could be made taxing or selling. One of the other costs that seems to come up is this impairment that goes on when you're using marijuana and federal employment regulations. I mean, the eastern part of Connecticut is built around, electric boat and things like that. And I understand that the federal government doesn't like to have um, factories and systems in states that have recreational marijuana. Do you see that as an impact because of the impairment levels?
Certainly, chronic marijuana use has long-term cognitive effects. Not to mention testing for it, there's still a limitation when you do drug testing to have you used it within the last 30 days because of the way it's metabolized in the body. So you're going to have to do increased drug testing, which obviously comes at a cost. And if we did lose federal grants, having come from Eastern Connecticut, if we lose that industry, that could be extremely harmful to all of our patients. But they have to have a way, because of these long-term cognitive effects in everyone that uses marijuana, to be able to have adequate work productivity and safety.
Good. So in summary, what we've said with the judiciary part, we do support decriminalization of it. We think the cost is our savings or expenses or whatever going to balance out what it's going to take to treat mental illness and all its other problems, what the cost of the increased trauma is probably going to balance out. So in the medical society's opinion, this has really now become a medical issue. Is it good for the youth of Connecticut that have already been twisted with vaping to give them free use to marijuana on a recreational basis?
And this isn't a theoretical, because many states have passed this, and we've seen the deleterious effects that it's caused on those states. So we're not talking in the theoretical. This is what will happen to Connecticut if we pursue legalizing recreational marijuana.
Again, I'd like to thank Dr. Greg Shangold, an emergency room physician, and the president of the State Medical Society for his thoughts today. Thank you again for taking time from your practice, Greg, by being with us today. Take care. Stay safe.
Thank you, Bob. My pleasure.
We're back to our social distancing and mask wearing. Thank you all for listening to our conversation on the Connecticut State Medical Society podcast. Please use the contact information provided here for questions and more information related to the legislative activities in the 2021 session. You can listen to other episodes of On Call with Connecticut Physicians at the Connecticut State Medical Society's website, csms.org. Be sure to engage with CSMS by following us on Facebook, Twitter, and LinkedIn. We look forward to seeing you here next time.